Hi, I'm Andrea Leonard, 36-year cancer survivor and president and founder of the Cancer Exercise Training Institute. I wanted to take a quick couple minutes to talk to you as a health and fitness professional working with cancer patients on a LAT flap reconstruction following breast cancer surgery. It's a bit confusing to people to understand that they actually take the latissimus muscle and tunnel it through underneath the armpit, bringing it out the mastectomy scar. So that muscle is still active and attached. And the brain, as far as neurological response, doesn't know that it is no longer back here. So if you logically think that you need to strengthen the lats because the lat is not supporting the back or scapular stabilization anymore, you could actually be making a big mistake by having them do exercises like rows or lat pull downs, because this will actually contract and relax, hypertrophy, atrophy. It will respond exactly as it did when the lat was in place on the back. So what becomes really important is stretching the chest, because now we have the pectoral muscles and the lat muscle in the front, causing really excessive round shoulder upper cross syndrome. So lots and lots of chest stretches, and then exercises that will work on scapular stabilization, but try and avoid compound exercises like rows, lat pull downs, and focus on just isometric contractions, shoulder scaption, army crawl, wall walks. We have all of these exercises listed in our cancer exercise specialist training manual. And I think the majority of people have no idea what they're getting into, because not only are you dealing with this lat issue, but you're also dealing with scar tissue and adhesions that are left from the mastectomy. You're dealing with emotional and physical scars, recovery time. Perhaps the patient has also undergone chemotherapy or radiation, and you have the acute and chronic side effects. And one of the most important things to know there is whether or not they've had lymph nodes removed or irradiated. That puts them at risk for upper extremity lymphedema. So you will want to start all exercise classes with some cardiovascular warming up, getting the body ready to exercise, and then upper extremity lymph drainage exercises. Then we go on to correcting any range of motion limitations, which I can assure you there will be, particularly on that affected side. And if they've had a bilateral mastectomy and reconstruction, then of course both sides are at risk if they've had lymph nodes removed on both sides. But certainly it will affect their posture and most likely their range of motion as well. So while we're going to want to correct muscle imbalances, first we get the range of motion back, then we pick corrective exercises. So for example, maybe a chest fly to open up the chest, also stimulating the pec minor, which can help with lymphatic drainage, and then perhaps a reverse fly, which will strengthen the opposing muscle groups in the back. And we start with little to no weight, see what their body can tolerate now with, in the absence of a certain number of lymph nodes or following damage from radiation. And then you slowly add repetitions and then add resistance, making sure not to wrap any bands around the affected limb, as that can restrict the flow of lymphatic fluid. They should have no restrictions in their lower body other than any orthopedic issues that existed previously. And then if they're on hormonal therapy, most of your clients would be struggling with weight gain. I would recommend that they see a registered dietitian or nutritionist who specializes who specializes in working with cancer patients. And then, of course, as the trainer, we're going to incorporate cardio, which will help them lose body fat. It will help with their energy level, and then working on the lean muscle mass. So in some cases, they may have a very difficult time losing weight on the scale, but we can help to improve their body composition and help them to feel good about themselves again. I'm thrilled that we're now offering live workshops in Asia, and you can also take the online course. If you'd like to learn more, visit ceti.teachable.com.